Thanks, Journey. Happy to be here. Glad to be here. I am Carrie Rona. I am here to try and bring you what I can on coronavirus. We do know that all they are reporting on now is the cases, and we definitely have more cases because we test more. Okay, so let's get to our first story. This article is from www.precisionvaccinations.com. Precision Vaccinations. An international research network of physicians and scientists is launching a Phase 3 clinical trial to evaluate whether the common measles, mumps, and rubella (MMR) vaccine can protect 30,000 healthcare workers against infection from SARS-CoV-2, the coronavirus that causes COVID-19. The Washington University School of Medicine announced on September 3, 2020, it is the clinical coordinating center for this international study, which is the first to evaluate it on a large scale whether the MMR vaccine can protect against the new coronavirus. The research team leading the trial points to growing evidence that suggests the MMR vaccine could boost an individual's immunity and may prevent infection from SARS-CoV-2 for a limited period. This is because the vaccine carries small amounts of live, weakened viruses that could train the body's immune system to fight multiple pathogens. If we discover that the MMR vaccine can help train the body's immune response to SARS-CoV-2 infection, then we will have something to administer very quickly while waiting for more specific vaccines and preventive therapies to be developed, stated these researchers. We know that the MMR vaccine is safe, and we think there are two main reasons that it could prevent COVID-19, said one of the collaborative's principal investigators, Michael S. Avidan, MBBCH, Dr. Seymour, and Rose T. Brown, professor and head of the Department of Anesthesiology at Washington University. The first is this vaccine includes small amounts of live but very weakened measles, mumps, and rubella viruses. This type of vaccine appears to strengthen the body's immune response to infections in general, not just to the viruses in that particular vaccine. A second reason the MMR vaccine may be effective is that there are similarities between the weakened viruses in the vaccine and the SARS-CoV-2 virus that causes COVID-19. All of these viruses have similar proteins on their surfaces that are involved in infecting cells in the body, so the researchers think that antibodies made in response to the MMR vaccine also may recognize and fight the SARS-CoV-2 virus. Merck's MMR2 vaccine will be used in this study, and its inactive ingredients include sorbitol, sucrose, hydrolyzed gelatin, recombinant human albumin, fetal bovine serum, other buffer and media ingredients, neomycin. The MMR2 vaccine is given as a shot administered subcutaneously, preferably into the outer aspect of the arm. The dose of the vaccine is the same for everyone. If a child gets the shot when he or she is 1 year old or older, a second dose is recommended, says the US FDA. The trial is co-led by Washington University, University College London, and the University of the Witwatersrand in Johannesburg, via the Crown COVID-19 Research Outcomes Worldwide Network, collaborative and involves researchers from institutions in African, European, and North American countries. The Phase 3 study, which was last updated on September 9, 2020, will recruit frontline healthcare workers, including those from lower and middle-income countries. The countries involved include Canada, Ghana, Ireland, South Africa, Uganda, United Kingdom, United States, Zambia, and Zimbabwe. Data from the trial sites will be compiled at University College London. Lawrence Lovett, MD, PhD, a professor of gastroenterology and biophotonics, is the study leader in the United Kingdom. Sponsored links. Discounts, appointments, clinical trials, lab tests. The Crown Coronation Trial's other principal investigators are Ramani Munsingh, MD, a professor of perioperative medicine at University College London, and Helen Rees, MD, Executive Director of the WITS Reproductive Health and HIV Institute in Johannesburg. The Crown Collaborative Research Platform was designed to rapidly evaluate preventive and therapeutic interventions to learn which ones work and which ones do not, Avidan said. Our goal from the start has been to identify interventions that work and make them available to the people around the world who will benefit most. The Crown Coronation Trial is funded by a $9 million grant from the COVID-19 Therapeutics Accelerator, an initiative launched by the Bill and Melinda Gates Foundation, Wellcome, and MasterCard, with support from an array of public and philanthropic donors. The Therapeutics Accelerator works to speed up the response to the COVID-19 pandemic by identifying, assessing, developing, and scaling up treatments. More information on the Crown Coronation trial can be found on the trial's registration site. Washington University School of Medicine's 1,500 faculty physicians also are the medical staff of Barnes-Jewish and St. Louis Children's Hospitals, located in the St. Louis, Missouri area. We at Q17 are not medical experts, but let me say this as a person that covers medical issues. Our elderly have been shoved away and let to die all by themselves in the state, and the professionals do not care. Governor Cuomo deliberately shoved and killed our elderly intentionally when he had places to isolate them. Instead, he isolated our most vulnerable and allowed them to die, and they died by themselves. I have seen online where they are setting up booths with plexiglass in nursing homes so you can't touch your loved one. This is insane, this is awful, and we are killing our elderly. I believe that our elderly would rather risk getting sick than dying without contact. What these officials are doing about trampling on our constitutional rights is wrong. Plain and simple, and we the people are getting pretty tired of it. These professionals have no right to tell us who we can have in our homes. They have no right to tell us to wear masks in our homes. You are an adult, you are smart, and I will bet you can figure it out all on your own. Think about it. Rules for thee and not for me. Gavin Newsom, Governor of California, goes to swanky French Laundry with medical professionals and no one is wearing a mask. They are lying to you, the survival rate is over 99%. Gretchen Whitmer, Governor of Michigan, husband is allowed privileges but not you, he is caught boating in at their summer home. They are lying to you, the survival rate is over 99%. Governor J.B. Pritzker, Illinois Governor, when he locked down that state he sent his family to Florida where they were not locked down. They are lying to you, the survival rate is over 99%. Tom Wolf, Governor of Pennsylvania, mandates you have to wear a mask in your home. They are lying to you, the survival rate is over 99%. Kate Brown, Governor of New Jersey, limited to no more than 6 people total, from no more than 2 households, indoor and outdoor. Limited faith-based organizations to a maximum of 25 people indoors or 50 people outdoors. No indoor visitation in long-term care facilities. They are lying to you, the survival rate is over 99%. Do you understand that our Constitution overrides all of this? They have no right to lock us down like they are. South Dakota, Texas, and Florida and many others are not. They trust that their citizens are smart and know. The left shamming someone because they won't wear a mask is stupid, and if masks work, why are they so scared you are not wearing one? Tuesday, August 19, 2008. Bacterial pneumonia caused most deaths in 1918 influenza pandemic. Implications for future pandemic planning. The majority of deaths during the influenza pandemic of 1918 to 1919 were not caused by the influenza virus acting alone, report researchers from the National Institute of Allergy and Infectious Diseases, NIAID, part of the National Institutes of Health. Instead, most victims succumbed to bacterial pneumonia following influenza virus infection. The pneumonia was caused when bacteria that normally inhabit the nose and throat invaded the lungs along a pathway created when the virus destroyed the cells that line the bronchial tubes in lungs. A future influenza pandemic may unfold in a similar manner, say the NIAID authors, whose paper in the October 1 issue of the Journal of Infectious Diseases is now available online. Therefore, the authors conclude, comprehensive pandemic preparations should include not only efforts to produce new or improved influenza vaccines and antiviral drugs but also provisions to stockpile antibiotics and bacterial vaccines as well. The work presents complementary lines of evidence from the fields of pathology and history of medicine to support this conclusion. The weight of evidence we examined from both historical and modern analyses of the 1918 influenza pandemic favors a scenario in which viral damage followed by bacterial pneumonia led to the vast majority of deaths, says co-author NIAID Director Anthony S. Fauci, MD. In essence, the virus landed the first blow while bacteria delivered the knockout punch. NIAID co-author and pathologist Jeffrey Taubenberger, MD, PhD, examined lung tissue samples from 58 soldiers who died of influenza at various U.S. military bases in 1918 and 1919. The samples, preserved in paraffin blocks, were recut and stained to allow a microscopic evaluation. Examination revealed a spectrum of tissue damage ranging from changes characteristic of the primary viral pneumonia in evidence of tissue repair to evidence of severe, acute, secondary bacterial pneumonia, says Dr. Taubenberger. In most cases, he adds, the predominant disease at the time of death appeared to have been bacterial pneumonia. There also was evidence that the virus destroyed the cells lining the bronchial tubes, including cells with protective hair-like projections, or cilia. This loss made other kinds of cells throughout the entire respiratory tract, including cells deep in the lungs, vulnerable to attack by bacteria that migrated down the newly created pathway from the nose and throat. In a quest to obtain all scientific publications reporting on the pathology and bacteriology of the 1918 to 1919 influenza pandemic, Dr. Taubenberger and NIAID co-author David Morans, MD, searched bibliography sources for papers in any language. They also reviewed scientific and medical journals published in English, French and German, and located all papers reporting on autopsies conducted on influenza victims. From a pool of more than 2,000 publications that appeared between 1919 and 1929, the researchers identified 118 key autopsy series reports. In total, the autopsy series they reviewed represented 8,398 individual autopsies conducted in 15 countries. The published reports clearly and consistently implicated secondary bacterial pneumonia caused by common upper respiratory flora in most influenza fatalities, says Dr. Morans. Pathologists of the time, he adds, were nearly unanimous in the conviction that deaths were not caused directly by the then unidentified influenza virus, but rather resulted from severe secondary pneumonia caused by various bacteria. Absent the secondary bacterial infections, many patients might have survived, experts at the time believed. Indeed, the availability of antibiotics during the other influenza pandemics of the 20th century, specifically those of 1957 and 1968, was probably a key factor in the lower number of worldwide deaths during those outbreaks, notes Dr. Morans. The cause and timing of the next influenza pandemic cannot be predicted with certainty, the authors acknowledge, nor can the virulence of the pandemic influenza virus strain. However, it is possible that, as in 1918, a similar pattern of viral damage followed by bacterial invasion could unfold, say the authors. Preparations for diagnosing, treating, and preventing bacterial pneumonia should be among highest priorities in influenza pandemic planning, they write. We are encouraged by the fact that pandemic planners are already considering and implementing some of these actions, says Dr. Fauci. Back to you guys.